NDTRS New Questions. Question 2b, Individual Health Identifier or IHI. The administrative detail section of the form has been modified to include a new field to capture the Individual Health Identifier in preparation for the future implementation of the IHI. This data field will only be used once the IHI has been rolled out by the HSE. Question 3a, Sex, and Question 3b, Self-defined sexual orientation. The gender field has now been replaced by two new fields. The rationale for collection of data on self-defined gender and sexuality comes from specific actions contained in the National Drug Strategy, or NDS. A key theme that emerged throughout all stages of the consultation process for the NDS was the requirement to focus on the needs of specific communities and help them to access services tailored according to their needs. In addition to the needs of prisoners, travellers, new communities and homeless people, the other key group identified was lesbian, gay, bisexual and transgender, or LGBT people. Remember, this refers to how the person defines their own gender and sexual orientation, regardless of any outward appearance. If the user does identify as transgender, then select Yes from the transgender option. If they have a preferred sex by which they define themselves, then also select either male or female. Question 7. Number of children. This is an entirely new field that will allow for the recording of the number of children that a client has, whether they are under or over 18 years of age. The new question will enable information to be collected in three age bands: less than 5 years old, 5 to 17 years old, and 18 years and older. It will also allow the living arrangements of the children to be captured for the first time. This means that in the future the number of children living with problem drug and alcohol users can be quantified. This will assist in estimating the number of young and older children at risk of hidden harm. Complete these fields as best you can, even if it's not possible to determine the age and living arrangements of every child. Question 9a, Education Highest Level. This question has been revised to record the highest level of education completed to date. In the case of a 15-year-old service user still at school who has not yet completed their junior cert, please select Primary Level for Question 9a, enter 88 for Question 9b, and select Student for Question 10 in relation to their employment status. Question 11a, Country of Birth, 11b, Ethnic Cultural Background, and Question 11c, Language other than English or Irish spoken at home. These fields replace nationality and ethnic background so that the NDTRS data collection reflects the ethnicity questions asked by the Central Statistics Office, or CSO. Instead of nationality, country of birth will now be recorded. The terminology for the options on ethnic cultural background have been standardized with the CSO terminology, and the option of Roma has been added. A new question on language spoken at home other than English or Irish has been included. Information garnered from these questions should assist with planning services for new communities. If you believe a language other than English or Irish is spoken at home but are unable to determine what that language is, then select 99 Not Known. Question 13, Main reason for referral. This question has been changed significantly. The options of illicit and licit drugs have been replaced by a single option of main reason for referral, and you are now asked to search for and select a specific substance. As a main reason for referral, you may also select concerned person to cater for service users directly affected by someone else's alcohol use or drug taking. If concerned person is specified, the whole online form can be completed for these clients, in which case all questions relate to the treatment of the concerned person and not the substance abuser. This is entirely optional as this data does not form part of the NDTRS reporting. Questions 21 to 25, Current problem drugs. 4 additional problem drugs can now be recorded instead of 3. This should allow for a better understanding of trends in polydrug use. Don't forget the first drug here will automatically be the same as the main reason for referral specified in question 13 in the referral assessment details section. Question 29D, number of previous alcohol detoxes. In order to understand better the harm of problem alcohol use, a new question looks to ascertain the number of alcohol detoxes a client has previously undergone. The need for alcohol detoxification can be an indicator of chronic harm caused by problem alcohol use. Please note this only refers to detoxes carried out under medical supervision. If the answer to this question is unknown, then select 99. Question 30C, frequency of injecting. In line with requirements for reporting to Europe, information on the time period during which the client last injected has been expanded to offer 4 possibilities. Question 30D, ever shared needles and syringes, and question 30E, ever shared any other drug paraphernalia. In order to comply with reporting to Europe, the questions on sharing drug equipment have now been separated out. Sharing of needles and syringes is to be reported separately from other drug paraphernalia such as straws and pipes. The time period for any sharing will also now be recorded. Never shared, shared in the past 30 days, shared in the past 12 months, but not in the past 30 days, shared but not in the past 12 months. In both cases, select 99 if the answer is unknown. Question 31, history of viral screening. This is a new question that should be asked of all service users and not just those who have previously injected, and it includes an option where the client didn't wish to answer. Question 32A, treatment interventions. Services will now be able to record the start date, end date and number of sessions of key working given during a client's treatment. The way detoxification is recorded on the NDTRS form has been changed. You can now record the specific drug that the service user is detoxing from. If the client has been transferred to another centre, this is now captured in question 33B, transfer or referral, in the exit details section. Question 34. At end of treatment or when last seen client is or has. The exit details section has been significantly changed. It now aims to capture more meaningful information on the condition, outcomes and progress of clients when they leave the service. Information about changes in drug and or alcohol use, about the progress with their care plan where applicable, and about engagement with other services on the road to recovery can now be collected. There is also an option to specify other outcomes important to different services, which will be monitored over the first year of data collection. Please select all the options that apply to the client. That was NDTRS New Questions.